I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about, do back injections work? Short answer, no. Before, everyone jumps on my case, everyone gets upset, everyone knows somebody, even themselves personally, who's had a back injection and it works, and they swear by it. I'm going to explain it. I know some people have had really good relief from them, so I'm going to go into a little bit more explanation from it. But I'm also going to explain to you why they really, in the long run, don't work. Most of them. I'm going to caveat that a little bit. So a lot of times when you're having back pain, an injection is one of the first things that happens. Now, back pain is a broad category. And I know everyone likes to talk about back pain like it's one thing. You have back pain and you have sciatica. It's all the same thing. And it's not at all the same thing. I've probably treated 15 back pain patients today, and not one was exactly the same. So it's a very broad category. So before you kind of jump on the bandwagon of, my friend had an injection and it worked, understand where the cause of your pain is coming from. That will determine the success of the injections. So a lot of times what will happen with injections is you wind up getting the first injection and it works magically. It's wonderful, took the edge off, took the pain away. If there was numbness and tingling going down your leg, went away, it was great. You think all is well. And guess what? For that time period, it did work. And I am not completely opposed to injections. I just want to say that. Do I recommend them? Not highly. But if you are in agony and you can't move and you need something to take the edge off, there is no better way to take the edge off than to have an injection. So, there are times and places where they are appropriate. But let's go back to, you had your first injection, worked great, felt great, wonderful. So it buys you maybe 2 or 3 years. Some people 10 years. But the pain got so bad, you had to go to the doctor. The doctor said, we're going to give you injections. And by the way, when people come to me and they're like, you know what, I went to pain management and all they wanted to do was give me medications and injections. They are managing the pain. It's in the name of the place that you're going. It is not I'm going to solve your pain, I'm going to fix your pain. It is a pain management. So injections, the medications, all of that is to manage the pain. It fixes nothing. So you have your first injection, everything goes away, life is great, and you feel wonderful. This can last years. It can last months. It can last days. It cannot work at all. Then what happens is the second episode of back pain where you have to go see somebody comes on. And you wind up and you go say, oh, I had an injection, whatever kind of injection you had. Worked great, do it again. Second shot may or may not work as well as the first shot did. Sometimes it does work wonders, but most of the time you're going to see either a decreased effect or it's not going to work at all. And then you're going to get frustrated because now you're in a severe amount of pain. And the injection that worked wonders didn't work. Well, why didn't it work? Because the first time you had back pain that sent you to the doctor, you didn't address the pain, you managed the pain. You didn't fix it, you managed it. So if that's, splitting hairs for you, then okay. But there's a difference between managing your pain and fixing your pain. When you fix your pain, if you do everything correctly, it's not coming back. When you manage your pain, it will come back. You're not, once that medication wears off, you haven't managed it long term. You haven't managed it for a lifetime. Why? One, did that pain come back? And two, what do you do not have it come back? So the pain came back, or the injection didn't work, because first of all, the pain came back because you didn't address the cause of the problem. A lot of times with back pain, and no matter what kind of back pain it is or what the cause is, there are multiple reasons why you're suffering from back pain. So it's very, very, very common for these injections not to work because they go after one specific thing. One specific thing, going after it is not going to allow that pain to decrease. It's not going to do anything to address the 5 different other reasons that pain is being caused. So people who have frustration and say, you know what, that injection, it just didn't work. My friend had it done and it worked wonder. It's not because it wasn't the exact same injection. It's just because your problem wasn't the exact same as your friend's. You need to understand that back pain and finding the cause of back pain is going to determine if this injection is going to be successful if you want to call it successful, successfully manages your pain. You don't address the root of the problem. Most back pain is caused by posture-related issues and repetitive stress syndrome. So repetitive stress syndrome is just sitting like this all day at your computer, at your laptop, clicking away. That is repetitive stress. That is what your body cannot sustain. But all of a sudden you get an injection, you don't change anything, and you just go back and you're doing this. And everything's great until your body can't take it anymore. And what happens is a lot of times now the actual cause that caused you to go flat on your back in the first place, caused you to get that first injection, was never addressed. Now you're dealing with years, okay, compounding what was originally there, now only years later. So now it's 100 times worse. Now people show up in this office and they can't literally move because the injection no longer works. They cannot sleep. They're literally going batty because they are absolutely in so much pain that they're not able to function. So when you go in and you get a back injection, and I don't care what it is, it may work and it may make you feel better, but it doesn't address the cause of your pain. Figuring out how to actually fix your back pain allows or needs for you to figure out what is the cause of it. And it's not sitting up straight for one day. And it's not walking into my office and standing up straight and saying, oh, I'm standing up straight because I call garbage on that. It is not how you're standing. You go back and you're like this. Posture is the number one cause of low back pain issues in this country. If you are to go into a daycare and throw a ball in the middle of a bunch of 2-year-olds, they're going to walk over to that ball, squat down, and pick it up. If you roll a ball in between a bunch of adults, we're going to bend over at our waist and pick it up, herniating our discs every time. The highest amount of pressure you can put on your discs and you can put on your back is when you're sitting like this or when you're standing. It is significant amount of pressure on your back. So posture is the key to making sure that your back pain is resolved. So when it comes to back pain injections, again, if you're looking to take the edge off, if you have a trigger point and you can't sit down and you just want something to take the edge off, but you're going to treat the cause concurrently with getting an injection, they really actually can work well. But that's not the case with most people. Most people get the injection. If it works, they feel great and they're like, done. That was the magic pill. There is no magic pill. If you go anywhere near a pain management center, you're not fixing anything. You are managing your pain. It is not going to fix anything. So, and it may take years to come back, but it will come back with a vengeance. It will come back and it will be 10 times worse than it was before. And it will take 10 times longer and 10 times more expensive to fix it, because now all of the things that you were doing to lead up to your back pain, you were doing that for 10 more years. There's always a cause for your back pain. It's not age. It's not I woke up and all of a sudden, this happened. There's a lot of repetitive stress in our everyday lives that cause back pain. And most people don't address it. And they just want to blame their age, or they just want to blame that their dad had a bad back and it's hereditary, and they just want to blame all these factors and not address the cause. So, in summary, do back injections work? Not really. I don't necessarily think they are the best course of action. Again, if you're going to be taking if you're looking to have the edge taken off and you're going to be doing some concurrent physical therapy, absolutely. But don't think that you've got the magic bullet because you went and got an injection and it fixed it. It didn't fix anything. It just numbed the pain enough. It just stopped the pain enough. And that's all most people want, and I get that. But if you don't actually address the pain and you don't actually find the cause of the pain, then it's not going to work. So I hope that cleared up some questions about back injections, and I hope everybody has a good night.